Most people imagine a stroke as something that happens without warning. One moment everything is fine, and the next moment someone collapses, unable to speak, unable to move, their life changed in an instant. And while that sudden, catastrophic presentation is real and terrifying, there is something that the medical community has known for years that most ordinary people have never been clearly told. In a significant number of stroke cases, the body sends warning signals in the hours and days before the main event. Signals that are dismissed. Signals that are misattributed to fatigue, or stress, or getting older, or something eaten at dinner. Signals that, if recognized and acted upon immediately, can lead to medical intervention that prevents the full stroke from ever occurring. Today I am going to describe exactly what those warning signals look like, specifically what a person may experience in the hours and the day before a stroke strikes, so that you and everyone you love will never again dismiss a symptom that your body is using to tell you something catastrophic is about to happen. Stay with me through every word of this video. This may be the most important thing you watch this year. My name is William Hart, and I need to start with something that I think is the single most important piece of context for everything I am about to share. There is a medical event called a TIA, a transient ischemic attack, that most people have either never heard of or have heard of without understanding its full significance. A TIA is sometimes called a mini-stroke, and while that name captures something of its nature, it dangerously undersells its urgency. A TIA occurs when blood flow to part of the brain is temporarily blocked, long enough to cause neurological symptoms, but not long enough to cause the permanent brain tissue death that defines a full stroke. The symptoms of a TIA can be identical to the symptoms of a full stroke: sudden weakness on one side, sudden speech difficulty, sudden vision changes, sudden severe headache, sudden loss of coordination. But in a TIA, these symptoms resolve, sometimes within minutes, sometimes within an hour or two. The person feels better. They think the danger has passed. They convince themselves it was nothing. Maybe they stood up too fast, maybe they were dehydrated, maybe they just had a strange moment. And then they go to bed. And in a frightening percentage of cases, they wake up in the middle of a full stroke, or they do not wake up at all. Research has consistently shown that a significant proportion of people who have a full stroke had a TIA in the preceding 48 hours that they either did not recognize or did not act upon. A TIA is not the danger passing. A TIA is the warning that the danger is coming, and acting on it is the single most powerful opportunity to prevent a full stroke that medicine can offer. Let me now describe specifically what these warning experiences look like. The symptoms that appear in the hours and day before a stroke, because the gap between knowing these symptoms in abstract and recognizing them in real life is enormous, and I want to close that gap completely. The first and perhaps most common warning symptom is sudden, temporary weakness or numbness on one side of the body. Not the gradual, symmetrical fatigue that comes from a long day or physical exertion, but a sudden onset of weakness or a strange, unexpected numbness that affects one arm, one leg, one side of the face, or some combination of these on the same side of the body. A person may notice that their hand feels heavy and unresponsive. They may find that their arms suddenly will not cooperate the way it should when they reach for something. They may feel a strange buzzing or deadness in one leg that makes walking feel different. They may notice that one side of their face feels numb or that their smile looks uneven when they catch their reflection. These symptoms may last only minutes before resolving completely, which is exactly why people dismiss them. But the one-sided nature of this weakness and numbness is the neurological fingerprint of a vascular event in the brain. The brain controls the body in a crossed pattern. The left hemisphere controls the right side of the body, and the right hemisphere controls the left side. When a blood vessel supplying one hemisphere is partially blocked, the result is one-sided symptoms. Bilateral fatigue and weakness, feeling tired in both arms or both legs equally, is almost never a stroke warning. One-sided sudden onset weakness or numbness, however brief, is a medical emergency until proven otherwise. The second warning symptom is sudden, temporary difficulty with speech or language, And this symptom takes several forms that are important to recognize individually. Some people experience expressive aphasia, the inability to produce the words they are trying to say. They know exactly what they want to communicate, but the words will not come, or wrong words come out instead, or their speech becomes garbled and unclear. Others experience receptive aphasia, sudden difficulty understanding what is being said to them, as if language has temporarily become foreign. Still others experience dysarthria, where the words are correct but the speech sounds slurred or thick, as if the person is heavily intoxicated. Any of these speech and language disruptions, occurring suddenly and without an obvious explanation, are urgent neurological warning signs. They are not signs of fatigue or stress. They are signs that the language centers of the brain, which are tightly localized, primarily in the left hemisphere for most people, are not receiving adequate blood flow. If you or someone around you suddenly has difficulty speaking, finding words, or understanding language, even if it resolves within minutes, that experience needs to be evaluated by emergency medical services the same day. Not tomorrow. Not after a night's sleep. The same day. The third warning symptom is sudden, temporary vision disturbance. And this is one of the most commonly dismissed pre-stroke symptoms because people so readily attribute visual changes to eye strain, tiredness, or simply staring at a screen too long. The vision disturbances associated with pre-stroke TIAs have specific characteristics that distinguish them from benign visual fatigue. They are sudden in onset, not a gradual blurring that develops over hours, but a vision change that appears abruptly. They often affect only one eye or one visual field, one side of the visual scene suddenly becoming blurry, darkened, or absent. Some people describe a sudden experience of vision loss in one eye that feels like a curtain or shade being drawn across their visual field, a symptom called amaurosis fugax that is directly caused by a blood flow disruption to the artery supplying the retina, which shares its vascular origin with the arteries supplying parts of the brain. Others experience sudden double vision, or sudden flashing lights or visual disturbances that are distinctly different from their normal experience. If any vision change is sudden, one-sided, and unexplained, particularly if it is accompanied by any other symptom on this list, it deserves emergency evaluation immediately, regardless of whether it resolves. The fourth warning symptom is a sudden, severe headache that is unlike any headache the person has experienced before, what neurologists sometimes call a thunderclap headache. Most headaches develop gradually over minutes or hours and feel familiar. Tension headaches, migraines, sinus headaches have characteristic patterns that people who experience them regularly learn to recognize. The headache associated with a hemorrhagic stroke or a pre-stroke vascular event is fundamentally different. It reaches maximum intensity almost immediately, within seconds to a minute of onset, and it is frequently described by those who have experienced it as the worst headache of their life. It may be accompanied by nausea, vomiting, sensitivity to light, and a stiff neck. Any headache that fits this description, sudden, severe, reaching maximum intensity almost instantly, unlike any previous headache, must be treated as a medical emergency. This type of headache can indicate a subarachnoid hemorrhage, bleeding in the space surrounding the brain, which is a form of stroke that carries an extremely high mortality rate if not treated immediately. Do not take a painkiller and lie down. Call emergency services immediately. The fifth warning symptom is sudden confusion or disorientation that is out of character and unexplained by other circumstances. A person who was moments ago fully alert and coherent suddenly seems confused about where they are, what day it is, or what they were just doing. They may ask a question they already know the answer to. They may seem to lose the thread of a conversation they were actively participating in. They may become uncharacteristically agitated, or alternatively, unusually calm and vacant in a way that does not fit their normal personality. Brief episodes of unexplained confusion in older adults are sometimes attributed to medication effects, low blood sugar, or simply a senior moment, and while those explanations are sometimes correct, they should never be assumed without ruling out a vascular cause. Sudden, unexplained confusion is a potential neurological emergency, and when it occurs alongside any other symptom on this list, even briefly, the combination must be evaluated immediately. The sixth warning symptom is sudden, unexplained dizziness, loss of balance, or difficulty walking, specifically when these symptoms have a sudden onset rather than a gradual development. The blood vessels supplying the cerebellum, the part of the brain responsible for coordination and balance, and the brainstem are particularly susceptible to the kind of partial blockages that produce TIA symptoms. When these areas are transiently deprived of blood flow, the result can be a sudden sensation of the room spinning, a sudden inability to walk a straight line, a sudden feeling that the ground is unstable, or a sudden loss of coordination that makes fine motor tasks feel impossible. Gradual onset dizziness that develops over hours has a different and broader set of possible causes. Sudden onset dizziness, particularly when accompanied by nausea or difficulty walking, is neurologically significant and must be taken seriously. Now I want to address what you should actually do if you or someone near you experiences any of the symptoms I have described, because information about warning signs is only life-saving if it is paired with clear, specific guidance about the correct response. The correct response is not to wait and see if the symptoms resolve. The correct response is not to sleep on it and call the doctor in the morning. The correct response to any sudden, unexplained, one-sided neurological symptom, to any thunderclap headache, to any sudden speech disturbance, to any sudden vision change, is to call emergency services immediately. The medical acronym FAST, face drooping, arm weakness, speech difficulty, time to call emergency services, is the starting point, but it captures only the most obvious and dramatic presentations. The full spectrum of pre-stroke warning symptoms I have described today is broader and subtler than FAST alone conveys. The rule that matters is this: when something neurological happens suddenly, unexpectedly, and out of character, the safest assumption is a vascular emergency until proven otherwise. Emergency services and a hospital setting can rule out stroke rapidly and safely. Waiting at home cannot. I also want to speak specifically to those who are watching this because they are caring for an older parent, a spouse, or a family member with high blood pressure or a history of cardiovascular disease, because in many cases the person who is having pre-stroke symptoms is not the person who will recognize them or call for help. Seniors sometimes minimize their own symptoms out of fear, out of not wanting to cause alarm, or out of genuinely not understanding the significance of what they are experiencing. The single most important thing you can do for a person at high cardiovascular risk is to know these symptoms on their behalf, to be the person who recognizes the significance of what is happening even when they do not, and who makes the call to emergency services without hesitation or apology. A false alarm that turns out to be nothing is infinitely preferable to a missed warning that turns out to be everything. Everything I have described today occurs within a vascular system that has been damaged and compromised over time. And in the vast majority of stroke cases, the single most significant driver of that vascular damage is chronically elevated blood pressure. High blood pressure damages artery walls. It promotes the formation of plaque. It accelerates the stiffening and narrowing of the vessels supplying the brain. Understanding the warning signs of stroke is only half the picture. The other half is understanding that the most powerful thing you can do to reduce your risk of ever experiencing those warning signs is to manage your blood pressure with the seriousness it deserves. Every point of blood pressure reduction, every dietary improvement, every medication taken faithfully, is a direct investment in keeping the blood vessels of your brain healthy enough to never deliver the warning symptoms I described today. Write down the 6 warning symptoms. Put them somewhere visible, on the refrigerator, in your phone notes, somewhere they will be seen and remembered. Share this video with at least one person who has high blood pressure or who is over 60. Check your own blood pressure today. And if you or anyone around you ever experiences any of the sudden neurological symptoms I described, one-sided weakness, speech difficulty, vision change, thunderclap headache, sudden confusion, sudden loss of balance, call emergency services immediately, without hesitation, without waiting to see if it resolves, without apology. That single decision, made in the right moment by someone who knows what to do, is the decision that saves lives. Be that person. Have that knowledge. And never let a warning go unheard. If this video gave you information that could one day save your life or the life of someone you love, please hit the like button and subscribe to William Heart Health, because every single week I am here with the honest, research-backed cardiovascular information that most people never hear until it is already too late.